So welcome to this first of a series of resources that we've developed on caring for people from a refugee-like background. My name is Rebecca Farley. I'm a GP from Queensland, and I've worked collaboratively with Dr. Rachel Clayton and Dr. Margaret Kay, also GPs in Queensland, to develop this module for you. During this first session, we're really going to just really provide a bit of an overall context and I guess just discuss some important considerations when we're caring for people who've travelled to Australia as refugees. And I think, I guess this reflects that very, very well. I think, in general practice, we're very, very used to really considering the whole person and really trying to provide that person-centred care in our work. And when we're caring for somebody that's travelled to Australia as a refugee or seeking asylum, it's just so important that we remember that journey for them. And sometimes it's obviously that's a little bit different perhaps to what it might be for somebody that's grown up here in Australia. So just really, really mindful, I guess, that when we're seeing somebody in our consult rooms here, that person has had to at some point flee conflict and persecution. So there's been that experience in their home country that's meant they've had to leave. That process of fleeing a country that again sometimes takes months, years, and the enormous, I think, trauma that can accompany that. Being then in a new country or a refugee camp or a detention centre, and again we know that for many people this can be a time that extends over many years. Many of the children that I see in my clinic were born in refugee camps, and with that I think comes all of those not having access to necessarily to good resources, limited nutrition, limited access to education and healthcare. So when we're seeing somebody here in Australia, they've just had such a different life experience and difficult journey. And then that process of applying for protection, which again can take months and years, and particularly I think pertinent here in Australia. We know some of our immigration policies, in recent decades, have resulted in people remaining in detention for prolonged periods of time, and the profound impact that has on their mental and physical health, is increasingly clear. So something that very, very much impacts on the patients that I see day to day in the clinic. And then even once somebody has a permanent protection visa, once they've got their citizenship here in Australia, the journey hasn't ended. And again, I imagine sometimes, trying to raise a child here in Brisbane with all of the, challenges that involves, differences in technology and all of those things that we all struggle with. But, when you grew up in a village in Eritrea, just such differences and such, such unique challenges that continue to impact on our patients for many years after they arrive here in Australia. So just always remembering that journey. I think whenever we talk about the care of people who've come to Australia as refugees, it's important that we consider that global context. So I've been talking on this topic really, I think, for about 10 years now, and these images here from the UNHCR really, show those global trends over the last 10 years. And unfortunately, you really can just see that kind of exponential increase in the numbers of people who are displaced each year. We were sort of looking back at that sort of 40 million mark back in 2012, and then 2022 we're really getting up around that 100 millions. So I think again sometimes those numbers can just be truly overwhelming. You can see there in that quote from Antonio Guterres, but they reflect that individual suffering that we see in our clinics. And I think rather than being overwhelmed by the scale of the challenges that we're seeing, and I think certainly these last couple of years as we've seen events in Afghanistan and Ukraine, and some of the impacts of climate change, so important that we remember the individuals who are experiencing these challenges. And this is something I think that we need to remember can happen to anyone at any time. So in terms of countries of origin and host countries, I think this is something, again, that often where people are very interested in terms of the work that we do here in Australia. those numbers really do again reflect, those international crises, conflicts around the world. We're seeing large numbers of people displaced from Syria. Again, if we look at the data from this last year, again, from Afghanistan, Ukraine, we see a lot of people from Venezuela. And when you look at those different countries there, it very much, I think in terms of the care that we're providing to people here in Australia, that diversity of countries, I guess, is very much represented in the people that we see. And we're going to talk a lot today about being culturally responsive in the care that you're delivering, being adaptable and responsive. And I think, again, when we talk about refugee health, we're talking about care for people from very, very diverse backgrounds, and it's really important to consider that. I wanted to just touch briefly on a couple of definitions, because I think, again, sometimes this can be challenging, I guess, in terms of the practicalities of the care that we can provide. When we talk of a refugee, we really are talking about that 1951 Refugee Convention, and we're talking about a person that is found to be outside of their country of nationality or habitual residence, that has a well-founded fear of persecution because of race, religion, nationality, membership of a particular social group or political opinion, and a person who's unwilling or unable to avail themselves of the protection of that country, or unable to return there for fear of persecution. And when we talk of a refugee here in Australia, really we're just talking of somebody who has sought asylum and has had their claim for a protection visa granted, and they've been found to meet, I guess, that description of a refugee in that convention. When we talk about people seeking asylum, these are people who in the most part are found to be refugees, just as we've described, and to have experienced, very much that same journey. But they're people that have sought asylum and are still awaiting on the outcome of their protection visa. And really, in terms of that journey, that's the difference. But the reality for what that means for people living in Australia, particularly people who have had a prolonged period in terms of that, that process of obtaining a permanent visa, it means that they've actually had a really prolonged period of having very limited resources here in Australia as well. If we move then to sort of numbers in Australia, and I think this is, I guess, really just to make sure that we are informed of the data and what we're talking about. I think sometimes in the media and in politics, there is this picture painted perhaps that these are overwhelming numbers of people arriving in Australia, and questions of our capacity to care appropriately for them are raised. Just important to remember, so this is data from 2018-19, so it's a little while ago, but I think that data over the period where we were responding to the pandemic really isn't reflective of kind of our usual migration program. So back in 2018-19, it's important to note that our Australian migration program was 160,323 people. Our humanitarian settlement program was just those 18,762 people, so about 8% of our overall migration program, so a very small number. And in terms of people seeking asylum onshore here in Australia, again, a really very small number of people, 1,650. So just important, I think, to keep all of that in context. And also, I think, important to know, so that is data from a few years ago, and we are now really looking to see significant increases in those numbers of humanitarian entrants over the next few years, really moving towards more that sort of 27,000 mark. Then again, to kind of give you a bit of a bigger picture around the context in which we're working, immigration policy and health. And I think this is an area that sometimes as clinicians we can find completely overwhelming, sometimes so much so that it, I think, makes us hesitant to feel that we can do this work well. There is a list of very, very, very small writing down the left-hand side of that slide. And before you, forgive me, I clearly don't want you to be able to read that. But that was just the number of policy changes over 1 year. Things are changing constantly. And the fact that you don't know the intricate details of Australia's immigration policy doesn't mean that you can't provide really important and quality care to somebody who's come to Australia as a refugee or somebody who's seeking seeking asylum. Again, as I said before, it really just comes down to being, I think, adaptable and being willing to go and search for answers when you need them. There are, however, a few important pieces of policy, I guess, that I want to draw our attention to, and they are just that depending on a person's mode and date of arrival in Australia, their living arrangements and service eligibility will vary. So people who are seeking asylum and haven't got permanent protection visas are particularly marginalised, I guess, in our community, find it particularly difficult to access services, often won't have work rights, won't have access to Medicare, won't have access to Centrelink supports. So that's important for us to recognise when we're trying to provide care. So you can see there, I've just said in that second point, visas and entitlements really do vary depending on someone's sort of visa, and that can change over time for the one individual person as they go through that process. Important also to know that since September 2013, the government's policy has been not to issue permanent protection visas to people who arrive by sea without a valid visa. And if found to be owed protection, they may be offered temporary protection visas, but still not a permanent visa. So I think, again, this is a cohort of people that have lived with prolonged periods of uncertainty around a sustainable resettlement option for them. Many of them have, left children behind and then not seen them for over 10 years, not seen them grow. And again, we know the profound impacts that has on health, and something, again, that we just really need to be very, very mindful of when we're caring for people in our community who have been part of that group. And then finally, again, we work in Queensland, and I think important to just also recognise that some states and territories do provide Medicare and eligible asylum seekers with access to public health services at no charge. So that is something that we do have available here in Queensland, and has been, again, has just made an extraordinary difference to our work. So for those people that don't have access to Medicare, who don't have access to primary care services, in some states and territories, they are able to access those hospital services, and it's really just about having a look in your jurisdiction around what the services available are. Then, I guess, again, in terms of that context, important to know what is available to you to support you in doing this work. So across Australia, there is a wide range of resources available to support you. And as I said before, I think sometimes it can be overwhelming trying to keep up to date with all of these changes. But there are places to go to find information. The Australian Refugee Health Practice Guide is probably, I think, nationally our main go-to for clinical resources, along with the Australasian Society of Infectious Diseases guidelines developed in collaboration with the Refugee Health Network of Australia. So there's two really important resources, but I'm often referring to the Refugee Health Network Queensland website, has a wealth of resources. The Victorian Refugee Health Network, I'm sorry if I'm not capturing your state, but really to recognise that across the country there are local guidelines and resources that it's valuable to access, and often there will be updates specific to specific communities that we might be seeing. So, we've worked very, very hard to make sure that we've got up-to-date information, as I know many across the country have, in regard to how to best support people arriving from Ukraine, how to best support people arriving from Syria. So really going and looking for that information is valuable. And as I said, these are the places that you'll find information about visa category and what entitlements patients will have if they're under that particular visa, what kind of settlement support is available local to you. There is a settlement support service, in all regions, how to access interpreters' information on how best to use them. We're going to talk more about that in this suite of resources, but again, great resources available online, and local referral pathways. So then, I guess, to come to our consultation room and the things that we're thinking about here, there are so many things to be considering, and I think we've talked about so much of this, but just before I might see somebody who's newly arrived to Australia the first time they come to our practice, I'm always reminded, I guess it was a kind of key time of learning for me. Just after I finished at university, I worked a little bit in East Timor or Timor-Leste, And I'm always reminded, I guess, of a patient that I saw in the main hospital in Dili at the time. That hospital at the time was really quite well resourced, but I remember just noting that this patient on one particular day was the only patient in that hospital, while on the same day, just down the road, there was another health service that was run by a beautiful doctor who had been working in the region for decades, and really had built that trust in the community. But it was a very, very basic service with very limited resources. And while there were 2 people in the main hospital, there would be hundreds of people waiting in this kind of dirt quadrangle to see the doctor on any given day. And over time, the story kind of emerged that basically, although people kind of knew in their heads that the hospital was well resourced and could provide good services, it had been used during the Indonesian occupation. Indonesian forces had run the hospital and people had been tortured there, they'd been killed. And so, over a decade later, they were just too scared really to go there, and the memories were just too strong. And I think whenever I'm seeing a patient for the first time, that kind of just sits with me, just being really aware of the enormous anxiety that can come with coming to see a health professional for the first time. Doctors, health professionals have not always been people to be trusted throughout the world. And so there can really be a significant distrust of authority figures and health sometimes. So important for us to be mindful of that. Important for us, and we're going to talk a lot about this in later sessions again, around cultural difference, linguistic differences, and what we can do to try and support patients as we navigate that. Religious differences, different gender roles, and just a lack of understanding of our healthcare system. I've, grown up in Australia, worked in our healthcare system for so long, and in all honesty, I still struggle sometimes to fully understand it. So again, if we think about, that mum, from Eritrea trying to navigate, how to get to an outpatient appointment, how to respond to appointment letters, all of those things, it's just such an extraordinarily big ask, I think, in many ways. So again, really, I think in this session, we're just trying to get you thinking a little bit about the things that we need to be considering and bringing to the consultation when we're meeting with someone for the first time, and just being really sensitive to those potential challenges.